Welcome everybody to the Rob and Mike Show. I am Rob.
Hi everybody, I'm Mike. Welcome.
Okay, today's topic is very important. It has to do with nursing home transition.
So I was just talking to Rob before we started here, and I had mentioned the fact that last Wednesday I was in Pittsburgh. We were at a training, and PICL, the Pennsylvania Council on Independent Living, has contracted with the Office of Long-Term Living to do nursing home transition trainings in all the nursing homes in Pennsylvania. There's 593 of them, so there's a lot. There's quite a few CILs who are involved in this, but over the course of the next 3 years, we're going to be hitting nursing homes to talk to staff, to the patients that are in nursing homes, consumers, clients. I'm not quite sure what residents, sure. It could be one of a variety of words that are utilized. We'll talk to the family members to talk about what does it take to get out of a nursing home if you want to get out of a nursing home. The reason being is there's no reason for somebody with a disability to be in a nursing home. I think that's kind of one of the stigmas is, oh, you have a disability, you must be sick, you have to be in a nursing home. And that's really not the case. Everybody has the opportunity to receive services in their home. I know for somebody who's on a waiver program, when we originally do the paperwork, one of the things that the doctor has to sign is that, and actually I believe Maximus and maybe AAA, like GCAC here in town, has to sign off that the individual is what's called NFCE, which stands for Nursing Facility Clinically Eligible. And every time we do that, people get nervous. They're like, no, I don't want to go to a nursing home.
Well, sure.
So, well, you're not going to a nursing home. It just means that you're going to receive the same care at home that you would in a nursing home. Okay. So, it's one of those things that you don't have to be in a nursing home to receive the care that you can get in a nursing home. So a lot of us who are living in the community can receive that same care. So that's great. I just think it's an opportunity to allow people with disabilities to focus on what they believe is important to them. When you think about the independent living philosophy, you think about words like choice, control, freedom, and equality. You have the choice to get the services where you want. You can have the opportunity to control the services that you get. Now, we're just as free as anybody else, and we are, on equal footing as anybody, whether you have a disability or not. You have the equal opportunity to get the services where you want them.
And this is a great program, if you want to call it that, because there's a lot of people with disabilities who may be in nursing homes who think that that's it.
Right.
Okay, once I'm here, I can't go anywhere else.
Correct.
And we know that after a while, let's say you're there temporarily, okay, and you get over whatever the medical condition is, you can return to your home. But we're talking about people that are there for other reasons and may not be aware that there is help out there to get them back to where they were.
Right, and that's exactly what we're here for.
That's exactly.
There are a lot of agencies in and around, we're limited to Pennsylvania. In Pennsylvania that provide the service of nursing home transition. We do, at CRI here, we do the advocacy portion. We don't do the funding part, and I'll get into that in a few minutes. But there are programs out there to provide funding to people in nursing homes to get them back home, get them back into the community. It's really great. One of the other key components of the independent living philosophy that is kind of a buzzword right now is called dignity of risk. And that's just something that's new. We all hear about choice control and all that stuff. Dignity of risk, I'm just going to read it so I don't get it wrong, is the right of a person to make an informed choice to engage in experiences they feel are important or meaningful to them. Sure. And I always think of myself a situation where I have the right as a person with a disability, just as somebody who doesn't have a disability, to go to a bar. Right. A lot of people would say, well, you're in a wheelchair, you shouldn't be drinking, you shouldn't be in a bar. Well,
why? It depends on my disability.
Is the chance that I'm going to fall out of my wheelchair there? Yeah, sure. And is there a chance that you're going to trip over something walking in your house if you're not in a wheelchair? Right. Yes. And so everybody has the opportunity to take on that risk.
Right. You can't wrap us in bubble wrap, and I think that
I'm glad you said that, because I was thinking about this when I was preparing all this stuff earlier today, and I thought of the Seinfeld episode about the bubble boy.
Yeah.
You remember that?
Yeah, I do.
We lived in a bubble, and
well, sure. And
you can't do that to somebody, to anybody, whether they have a disability or not.
Right.
And I think about like the helicopter parent who's always behind their child, making sure they don't fall down, they don't
Sure.
get, bruise their knee or get dirty. Well, that's going to happen. At some point, it's going to happen. You have to let it happen.
And
That's how they grow.
even in 2023, some people, and well-meaning, friends and family, they want to treat us like we're little glass figurines,
Right.
and we're going to break. Okay, well, we have just as much right to make decisions that might be stupid as the able-bodied.
Exactly.
To say,
Exactly. It's funny. I play. I'll get to this, and we talk a little bit more later about recreational activities and
Sure.
making sure you have that kind of thing set up if you are going to come out of a nursing home. Not that you have to have that ready, but nice to have some ideas of what you might want to do to keep yourself, keep yourself involved in the community goals, keep yourself involved in the community. But you said something about people think you're going to break. I've got some friends. I play bocce at a little club here in town, and some of my friends, like when they lift me up or downstairs, they're super gentle. They're so afraid they're going to do something wrong. And my best friend, he's probably lifted me up and down 10,000 stairs over the course of my life, and he treats me like a rag doll. Here I go. Like, I don't even know what's going on sometimes, but yeah, it's and I understand that. I trust him. He does it, but that's an aside. That's not really necessary to talk about. So where does all this stuff come from? This nursing home transition, and we're talking right now about we have the right to freedom, choice, and all that stuff. It all dates back to 1990 with the Americans with Disability Act. The ADA was passed and prohibits discrimination in a wide range of things. But even bigger than that came in 1999, the Olmstead decision, which was a landmark decision by the Supreme Court that basically said that people have the right to receive services in the most integrated setting within their communities that are appropriate to their needs.
Yeah, you said Olmstead, boy, I thought, wow, there's a blast from the past. Right. I had to think of what that was, because that's going all the way back to, that's over 20 years ago, yeah.
Right, so basically it's all about unnecessary segregation.
Sure.
You have the right, like I said, to find the most integrated setting and live in that most integrated setting. So is a nursing home the best setting for some people? Probably. But is it for everybody? Absolutely not. I think you have to look at things. You have to look at what you want, what you need, and whether or not you think you can manage on not being in a nursing home.
Yeah, I think it's important to note that you're not saying everybody who's in the nursing home, they get them out of here.
Right.
You're not saying that, because like you said, there may be people that's appropriate for that environment. Sure.
1,000%. So in Pennsylvania right now, there's a program called Money Follows the Person. And what that does, it's a Medicaid program that provides financial assistance for people who are in nursing homes who want to return into the community.
Okay.
So that's kind of the agencies that are providing, we just refer to as NHT. There's so many acronyms.
Oh, I know. You drown in them.
So when agencies are providing NHT, nursing home transition, they oftentimes for people who are on Medicaid will use these dollars to help them get out, to make sure their house, if they're returning their house, it's accessible for them. If they're going back to an apartment, maybe they have to pay a first month's rent.
Right.
Maybe help furnish it, maybe help modify the bathroom with the kitchen or something to make it a little bit easier for them.
Well, to use a tired cliche, to level the playing field.
Right.
So they're not coming back into a chaotic situation where it's like, it was better in the nursing home, that kind of thing. Yeah.
Well, a lot of people think, okay, I'm out now. Well, I remember I spent 9 months in the hospital, in the rehab hospital. And when I came out, had my father not really prepared things services-wise, it would have been very difficult for me.
Sure.
So what is out there for people when they're getting out of nursing homes? The first thing I think about are home community-based services.
Right.
People having the opportunity to get attendant care to help with their bathing, their dressing, their bowel and bladder routines, their medication disbursement,
Deals on wheels,
right, and all that stuff's good. Sure. I think that allows people to become productive members of society. We're talking about, now we have an opportunity to maybe get into the workforce, spend more time with families and friends. You're not really spending much time with families and friends if you're in a nursing home. When I was in the rehab center, I knew I was out in 6 months. I had friends there every day because they was in Pittsburgh. They came every day. They visited just to make sure. If I was still in a nursing home, that stuff wouldn't still be happening.
No.
Your family and friends, it just becomes less and less and less over the course of time. and now being able to live in the community and do things with my family and my friends, it just means I'm with them all the time, and that's what I value. That to me, that's the most important thing in my life. Just
and
certainly quality of life.
And that's right. And certainly living in the community doesn't mean there are no problems or situations or anything like that.
Absolutely.
You're going to have your challenges with attendant care, which we've talked about before, and other services and things of that nature. But for me, at least, it would be much better than being in a nursing home.
I totally agree. And I'm glad you just brought that up, because one of the next things I was going to just mention was barriers to come. What are some barriers to coming out of a nursing home? And I think the first thing is, you want to make sure you have attendant care set up.
Sure.
If you're going to be in the need of attendant care, you want to make sure you have it set up. So right now, with the length of time it takes for the eligibility process, that could be something that is a barrier to getting out.
Mm-hmm.
You think you're getting out next week. Well, guess what? That process takes 30 to 90 days.
Sure.
You're not getting out in 30 days or next week. So that's one of the major barriers. Now, when you do get out, you get services. Think about people on agency model. Right now, there's a shortage of direct care workers.
Big time.
So trying to cover all these people, cover shifts for people to make sure they have their needs met is difficult.
It is.
And it's just one of those things
that was one of the primary challenges that I was referring to.
Mm-hmm.
Because it seems like everybody is short of workers. I think it's getting a little bit better, but we still have a long way to go across the board, not just attendant care, but in all different fields.
Right. Oh, for sure.
Yeah.
Well, think about it. Carl always brings this up because I drove my sheets the other day and I look at the sign that says starting wage $18 an hour. He said, "Well, I can't compete with that."
That's right.
We only get paid. We're getting paid from the state, and it's a set amount. We can't sell more of something to get more money. It's set in stone.
It's a different world.
What we get.
Yeah.
So now you have somebody you say you get $18 working behind a counter at Chiefs, or you can get $13.30 as a direct care worker. Well, more than not, they're taking that other one, unfortunately, unless they're the big-hearted, good person.
Yeah, they're really into helping, and they need to be able to feel more useful,
right,
or that kind of thing than standing behind a counter.
Yeah.
One thing I wanted to ask you about the program, Mike, is do you anticipate resistance from the nursing homes?
I'm glad you said
because you're coming in and raiding our people or whatever.
Yeah, I'll talk about that. Now I'm going to go back to barriers for 1 second because I'm going to talk about one major one. We do anticipate some resistance, and because we contracted with the Office of Long-Term Living, who also is a funder to for Medicaid to nursing homes, we basically have been told to tell OLTL who does not cooperate with us. I don't know if they're going to get a slap on the wrist or a stern talking to or what it might be, but it's something that's been contracted and is to be done. And through like I said, it's Pennsylvania Council on Independent Living is the sanctioned group that's going to be doing this. So, it's but I can see resistance. I can see them say, no, we're not going to post that, or no, we're not going to, because you're right. Why would nursing homes who are getting paid want to allow their residents to leave?
Yeah, they want to fill those beds.
Right.
And it's like, hey, wait a minute,
So yeah, but we have to, and that's why we're doing this as an educational thing. We're not stealing people out. We're not forcing people out. We're letting them know that there are opportunities.
They have options.
You have options. You have opportunities if you want to live in the community. Whether or not you take advantage of that opportunity is completely up to you as a person with a disability. So yeah, that's going to be a barrier. The long eligibility process, like I mentioned, was a barrier. Another barrier, just think about home community-based services in general, attendant care. A lot of people don't even know that exists.
Oh, they don't. They don't. They
especially somebody who's newly disabled might not understand what's out there and available to them.
Right, it's intimidating.
Yeah.
It's an intimidating process. You don't know where to begin. You don't know who to call, who to talk to, and there may be almost a false security in staying in the nursing home, because at least I don't have to think about anything here.
That's true. Except lack of freedom, I guess.
That's right.
Would be the one thing. I also think about a barrier like housing. You're somebody who was not using a wheelchair, now you are. you're going to need modifications or a whole new living situation.
Absolutely.
So the percentage of accessible units compared to non-accessible units is, I don't know the number of.
Well, we look at what,
It's gotta be
5%?
Maybe 5%
Yeah,
maximum.
maybe,
When
yeah.
you start talking about apartment complexes, most private landlords aren't going to make their place accessible
No.
just because. So you're looking at very few units that are already filled up. So trying to find something for somebody is going to be.
And then you're on, and because of that, you're on like what seemingly endless waiting lists and stuff that may go on. Yeah, they may go on for years.
We typically tell people about waiting lists are a year to 18 months, which is, I mean, if we can get it done sooner than that, we look good. But that's typical.
That's average, yeah.
So that's what we tell them. The final beer I want to talk about, and I think this is an important one, and it's kind of sad, is family. Because family sometimes doesn't want, family looks sometimes at the person with the disability as a burden.
Right.
Why do we want that person in the community that they're taken care of here? Why do we have to take care of that person? So sometimes communicating and educating the family that, hey, you might be an informal support, but you don't have to do all the work. There are other programs out there that are going to help with this.
That are less expensive.
Yes.
That's one thing, because you don't know, the family dynamics are very complicated.
Right.
You don't know how close this person is with their family, how much family they have left. Who knows?
True.
And maybe the family is not in a position with their own health to take care of this person.
Like I said, they look at it as a burden. Like,
That's right.
It's harder on me if I have this person out. So, you know, and it all comes down to education. You know, communication and education. So that's what we're going to be doing over the course of the next 3 years, doing this stuff. And what I think you do is, if you're somebody in a nursing home, you make sure you have a good informal support system. You get to know your local center for independent living. Find out what resources are available in your community, and
Sure.
that's something the SIL can help with. And talk to the staff at a nursing home. I mean,
Well, a social worker.
social worker,
too, yeah.
social worker at a nursing home, they should be there to give you a hand.
Right.
If you say to a social worker, hey, I want to get out of this nursing home, they should be there to give you a hand with that.
That's what they should do.
That's
Sure.
what their job is. You know, and like you said, the dollars come from filling the beds.
Right.
But you have to look at people's dignity. You have to respect their decisions, their choice of where to receive their services, and all the stuff that we got started with.
I've always said, and that, you know, if I have to go to the nursing home the rest of my life, well, bring a gun with you. Because the way I look at it, my life's over.
You're right.
That may not be the correct way of looking at
I
it,
know what you mean.
but compared to how active I am now, and you are too,
Right.
you know, what would we do in nursing homes? I mean,
There's only so many days for me I can play bingo.
that's right.
You know, and I'm, you know, like I said, nursing homes are the right place for some people.
Sure.
But there's a lot of people, like you said, are stuck and they don't know how to get out. And that's what we want to do, is we want to teach people how to get out. We want to give them the resources on who to contact, what to say, you know, what to have ready in order to be able to come out and be part of society. I mean, there's no reason to not be like we're living today.
Absolutely. And I think, and it's important that the way you approach the nursing homes, like, we're not trying to steal your people, your patients. We're letting them know that there are options.
Correct.
Maybe if you stress that, you'll get less resistance. I don't know. Maybe,
So we have a letter ready to go.
maybe that's too optimistic. I don't know. But
So like I said, we're going to be doing this with not CRI, but CILs across Pennsylvania.
Right.
We're going to be doing 593. We have a letter that's going to go to the nursing homes. We're going to send this letter out with a phone call follow-up that says, hey, we want to schedule something for 30 days from now. It's going to take about 35-minute presentation, and what we want you to do is post this somewhere, like on a message, either a bulletin board or something that says, you know, come, feel free to come and listen to this presentation, bring your family members with you. whatever. And like you're saying, just to tell them, here is your option.
Do you know if this program is limited to Pennsylvania, or there are other states doing things similar to this?
So I would imagine there are other states that do things similar to this. This one is Pennsylvania because it's
right. Yeah, I understand that, but like maybe Ohio calls it something different.
Right, and that
different agents.
Okay, I don't know.
Okay,
we're kind of self-contained here in Pennsylvania with what we do. I can't imagine there's not. You know, Pennsylvania is unique. We're I want to say like the 5th oldest state in terms of age in the whole country. So there's a lot of aging folks in nursing homes. So I can't imagine we'll be a lot of what we say might be falling on deaf ears in that situation, just because that's the right place for some of them. But there are those people, like we said, that have disabilities that just don't know.
Yeah, it's hard for me to believe that Pennsylvania is unique with this. I mean, it's got to be sort of a movement that maybe it started in PA, but it's spreading across the country.
Well, think about it. So the waiver programs, the nursing homes, they're all Medicaid funded, which comes from CMS, which is a federally funded agency.
Yeah.
So I would imagine that they are putting dollars into every state saying, let's get people out of nursing homes.
You would think, yeah.
You know, a nursing home is much more expensive. So for the I don't know, it used to be almost 3 to 1. Like to keep somebody in a nursing home would cost about $75,000 a year. To keep people out of nursing homes and in the community, it was about $25,000 for home community services.
Wow.
The gap is closed a little bit, but it's still significantly more. It's probably a little bit better than 2 to 1 at this point.
Yeah.
So we're doing the state, good.
Absolutely.
Really
Yeah,
good.
That's been an argument forever
Yes.
about the nursing home transition. When they're charging you $20 for a Q-tip or something, you know what I'm saying? I mean, it's definitely cheaper to live out in the community, and society in general. Look how much more they're gaining in terms of what people with disabilities can contribute to the economy and to society and all of that. You can't put a price on that.
Exactly. I wrote down some components of transition that we're going to be focusing on talking. Okay. We've talked about a lot of these things, but I'm just going to go through 12 of them. The first thing is the role of the family and friends and the importance of that. And I think having your informal supports, if you're going to transition, having informal supports ready to go. And that, to me, like I said, you're talking about what we can contribute, just the value of your family and friends. I think not that you're contributing, but you're with them, and they see a friend. You're a friend, you're a loved one, you're whatever you are. It's there's value in that.
Of course there is. Yeah.
Housing, we talked a little bit about that. Make sure that you have a situation. If you're going to be transitioning out of nursing home, make sure you have something prepared, because you're not just going to get out and hope.
Right.
We've had people actually where they go home, nothing's ready. They get in their house. Once they get in their house, they can't get out. There's no ramp.
It's the same thing. They're basically in an institution, but just at home.
Just at home by yourself, not with anybody else. I would say make sure you have healthcare ready to go.
Right.
So you want to make sure you have your doctors, your therapists, or whatever lined up, so that when you do go home, you have that person to call if you ever need them. Your personal assistants, your attendant care, have that ready to go. Home adaptations and assistive technology. Home adaptations and housing could fit together. Assistive technology, we have a program here called Tech Out. Technology for Our Whole Lives that Rosanna Wayne runs. Someday we'll have her as one of her guests. And she's what's called an assistive technology resource coordinator here on behalf of Temple University. And she can get all sorts of devices for people to make life a little bit easier. So assistive tech is important. Know where to get that stuff. So basically, that's kind of what I'm saying with all these things. Know where to get the stuff, have the stuff kind of ready to go.
And there again, that's where somebody at the nursing home, or at least they should, a social worker or somebody who's helping you to transition.
Yes.
There should be somebody who does that.
Agreed. I have transportation written down here, set something up with your local center for independent living, set something up with the local
The
paratransit,
lift or whatever.
community integration and social activities and recreation. I think that's important. Don't, you just mentioned a minute ago, don't just go home and sit in you're sitting in between those four walls, because what's the difference?
Yeah.
Have something ready. Like I said, you're out all the time. You're in the community constantly. I try to get out as much as possible. I play bocce with my buddies a couple times a week, so I go out and doing that. Spending time at my parents' house. Yeah. So I feel bad for my dog, so I'm never home. That's all.
Oh, I know. Even my
cat.
cat.
Right.
Even my cat. If Kathy wasn't there,
Right.
I'd be like, I never get to spend time with him.
Right. Yeah. With regards to like recreation, you call your local center for independent living. There's so many activities. We've got our wellness group here at CRI. We've got art class that's going to be happening here outside in the kitchen area in just a few minutes. So there's so many things that are happening in the community that you can get involved in.
Volunteer opportunities.
Volunteer or work. Right. We here at CRI, we have a peer support program. So if you're somebody who's out of a nursing home, you want to help somebody to understand their disability a little bit better, come and volunteer. That's a great opportunity. Maybe you want to get back into the workforce. We can help you with that.
Part-time or full-time.
Right.
Whatever.
Yeah. A lot of times, you might not want to. There are certain benefits you don't want to lose. Sometimes part-time is not a bad situation.
Or maybe your disability is such that you can't work full-time.
Right. Well,
You have to work part.
Yep. So have your finances in order. I put down here any advocacy issues. You can talk to your Center for Independent Living. They'll help you with that stuff. There's just so many things to understand and know, and I think that's one of the important things. Doubling back now to how we first started this nursing home transition, this program where we're going to be going into nursing homes. It's all about education. We're letting you know that these are the things you need to have and have ready if you want to transition out.
Right.
And don't be overwhelmed by it, because there are people there that will help you.
That's right. Yeah.
So I think that's important to know.
Okay.
And I just think it's going to be a great opportunity to get people out and doing things that they really want to do.
Well, it sounds really exciting, and it's going to be exciting, because when you get a certain percentage of people who look at this and say, hey, yeah, I want to go back home.
Right.
It's very rewarding.
And even if we help one person get out,
right,
it's a worthwhile cost.
Absolutely.
I remember I was a teacher for a while. When I was student teaching, the advisor one time said, if you touch the life of one child in your entire career, your career was worthwhile. That's kind of how I look at this. If I help, if I talk to somebody and they listen to what I say and they say, I want out.
Because you don't know,
I've done a good job.
You don't know how many lives that person could change.
Correct.
Just from being
exponential. That just keeps going on and on and on. And obviously I would help more than one.
Sure.
But I'm saying it's still worthwhile if you help one.
Definitely.
That's all I'm saying.
All right.
Hey, if you have any questions on anything that we talked about today, you can feel free to call here at CRI.
Yeah, call CRI.
If you have family members that are in the nursing home, you want to talk about getting them out, I'm more than willing to sit with you and talk to you about what we can do to help.
And CRI's number, in case you don't know, it's 814-838-7222. And just ask for you, Mike?
Just ask for Mike. I'm the only one in the office. They'll direct you right to me.
Okay. All right. Thank you, guys. I am Rob.
I'm Mike.
And we will see you next time.